I'm on unpaid maternity leave, and my hours were cut because I wasn't feeling well towards the end, and just unexpected expenses and car repair, anything you could think of that can pop up at a bad time did.
As a maternal health advocate, I work with pregnant mothers and their families just to ensure that they have access to fresh, healthy food each week. I also get them in contact with any community resources that they could possibly need. We're seeing that when pregnant people are food insecure, they're having more chronic health issues. So that's becoming more costly for insurance agencies and hospitals, but also just more costly as a society.
Used to deliver backpacks. You would just go up, and what you had is you had a truckload of food with a push cart that had 200 backpacks or whatever of food in it. But my memory, and part of why I kept doing it for a long time, was when if the kids saw me come in, they knew exactly what I was bringing. So they knew that was the food they got to take home for the weekend, and the excitement on their face was just off the charts.
The need is so great, and even though they have summer school, oftentimes their parents are working, sometimes even 2 jobs, and so they rely on other places to get food. We actually have a client right now who's in foster care. Unfortunately, he's lost both of his parents in the last couple years, and he's really enjoys the fresh meals and is often asking me, or he'll call me up before the after-school program even starts, and it says, "Do you have fresh meals today?" Or "Do you have a meal today? Is the after-school program happening today?"
Our team here is really focused on, again, listening to the community, understanding the community, and trying to figure out not only where there are gaps in service, like geographically, but population-wise, like who are we not serving?
And it's important when we're talking about and trying to address food insecurity that we check our own bias and we keep an open mind, because it impacts across demographics. And while we think of it oftentimes in pocketed communities, the reality is it's pervasive.
A lot of people in our community live in what's called pharmacy deserts and food deserts. And so, which means they don't have adequate access to a pharmacy or a grocery store. And so supporting this type of work ensures people in our community have access to free home delivery, not only for their medication, but also free fruits and vegetables so that they become healthier.
When we provide for those who are struggling, the entire community, the entire society benefits.
Changes to the facility is going to definitely make our work a lot more efficient, and I think it's going to allow us to be more collaborative, but also allow for more community members to be able to come on site, to be able to utilize some of the services we have. And so we're really being able to build beyond just the food distribution, food banking model.
In addition to having more cold storage, we'll also have more shelf-stable storage. So we're pretty much doubling our storage capacity. That will help us to really deliver more food and hopefully touch more lives. But in addition to that, we're going to have a commercial kitchen as well as a teaching garden. So opportunities to use our space for not just teaching, but also building communities.
If we are to eventually make a long-term impact on food banking, we have to look at that system. So we think about it from seed to feed. So that's more neighborhood gardens over here. That's more farmers being involved in the process and the food chain. So that if we're buying food for Metro Market, or if we have any ways by which we can implement and include those farmers in our process, that is us looking at the bigger and much fuller community food system so that everybody's involved.
I love working with people, and I love people. I told my wife the difficult part for me is how people treat one another. And I see it in our world today, why we can't share and help each other. It doesn't mean I have to give what little I have to someone else, but I can share some of it.